According to the Centers for Disease Control, over 1 million people are living with HIV in the United States. 1 in 8 people have no idea they have the disease. In the Sandy Springs community, over 1,300 people per 1,000 residents are living with HIV. Today, we're going to share a brief script as well as some education on HIV and its prevention. I am Rhonda, and I am going to be playing the role of Nurse Practitioner Hood.
I will be playing the role of Jose, a young man who is diagnosed with HIV, and you will be able to see how difficult it is to accept that diagnosis, and I will go through the steps of denial.
I'm Dariana. I'm going to be a nurse providing education.
My name is Amber. I'll also be a nurse.
My name is Fantasia, and I'll be Jose's girlfriend.
Good morning, can I help you?
Good morning. Yes, I have an appointment at 11 a.m.
And your name is?
Jose Reyes.
And you are?
Fantasia.
Okay, please have a seat. We'll be right with you.
Sure.
Jose?
Yes.
Hi, can you come to the back with me, please?
Sure. Do you mind if my girlfriend comes?
No, that's fine. She can come. Please have a seat over here. Okay, so my name's Dee. I'm going to be one of the nurses helping to take care of you today, okay? What brought you in today?
Well, I've been having trouble sleeping, and when I wake up, I'm sweating and cold.
Oh, no, okay. How long has this been going on?
A couple of days, I'd say 5 or so.
Okay, do you know of any other symptoms that you may be experiencing other than that?
I've been getting headaches a lot, and my body hurts. all
Okay.
over.
Do you know if you've been around anybody who has the flu or has a cold or anything?
Not that I know of. I did get my flu shot this year.
Okay, that's good. Okay, so now I'm going to ask you a few questions about your social history, okay? Is that fine?
Yeah.
Okay, do you smoke or drink alcohol?
I've never smoked. I do drink every now and then.
Okay, are you sexually active?
Yes.
Okay, how many partners have you had, and are you currently in a monogamous relationship?
I've had 3, including my girlfriend, and we've been together for 8 months. I've never cheated on her or anything. It's just us 2.
Okay, so now we're going to need to draw some blood on you to determine why you're having those symptoms. And we recommend that all patients who are sexually active get STD testing and HIV testing. So do you mind providing consent for those?
I don't think I have anything of that sort, but yeah, I mean, we can run some tests. That's fine.
Okay, cool.
Good morning, I'm Nurse Practitioner Hood. I called you about your test results.
Good morning, Jose.
And Jose, nice to meet you.
I'm Fantasia.
Fantasia, you're Jose's girlfriend?
Yes.
Okay. Jose, as you know, we ran some blood work tests on you to find the root cause of your infection. That also included tests for sexually transmitted diseases as well as HIV testing. Are you okay with me sharing the results with Fantasia here?
Yeah, sure. Whatever you can say to me, you can say in front of her.
Okay, good. Jose, I need to tell you that you did test positive for the HIV virus, which causes AIDS.
That's not possible. There's no way I can have that.
So, like, what does this mean for me?
Well, Fantasia, I would recommend that you get tested at our clinic today.
Okay.
Okay. All right, Jose, your nurses, Amber and Dee, are going to come in shortly and give you some more information on your diagnosis, okay?
Okay.
Fantasia, if you'll just come with me, please.
Hey, Jose, so this is Amber. She's another nurse who's going to be helping take care of you, okay?
We're just here because we need to speak with you about the next steps regarding your HIV diagnosis.
So NP Hood, she's going to prescribe some medications for you. Do you think that you may have any concerns with affording the medication?
I mean, I don't even know how much they would cost. I can't even think about that right now. I don't know.
Jose, we know how frustrating it can be to be diagnosed with something like HIV. It was very random. You weren't expecting it. We do want you to know that there are a lot of support groups out there that are willing to help you, provide support for you, okay? So here's a pamphlet. Positive Impact and Aid Atlanta are 2 amazing organizations that provide support to patients who are in the same position as you, okay? Another thing that we want you to know is that compliance with your medications is imperative. You don't want to miss any doses or anything like that because you can prevent progression of HIV from just taking medications, okay?
And if for whatever reason there is a financial issue, we do have financial support groups as well, and that's what's going to be on this pamphlet. You can look them up, and don't let finances be a reason that you can't get your HIV medications, okay?
Thank you.
HIV diagnosis can be very scary and overwhelming, so overwhelming that you need to engage your family, your friends, and have a good support system. Trying to go at it all alone can end up with devastating consequences. Isolation can really lead to the further enhancement of the disease process. That's why it's so important that a good, healthy support system is maintained at all times. There's groups out there that can help, such as Aid Atlanta and Project Positive Impact Atlanta, that offer educational support for those newly diagnosed with HIV, as well as preventative measures to help prevent the spread of HIV and AIDS, and also help with support groups so the person that's newly diagnosed can go to groups and share how they're feeling and get embraced by other people in the same situation. It's important that everyone knows that they're not alone and there is help out there.
As we saw in the video, being diagnosed with HIV is a major lifestyle change, but there are steps we can take to prevent this. In the United States, the two most common ways of contacting HIV is through the use of needles to inject drugs and unprotected sex. So we can start off with those two, as well as communicating with your partners before you have sex, getting tested when you have a new partner. And to get tested, there's a website, the CDC developed, gettested.cdc.gov, and there you can search for clinics in your area by zip code that are free, and convenient locations. In the recent years, there has been a development of a pill called Truvada, which is pre-exposure prophylaxis, known as PrEP. If taken every day and used with other prevention methods such as condoms and not sharing needles to inject drugs, it can reduce the risk of transmission by 92%.
And also, once you get the disease, there are things that you can do to control it. So many people in the world today have HIV, but that doesn't mean they can't live a full life. With proper diet and exercise, people with HIV can live as long as someone without disease. A well-balanced diet is encouraged to maintain a healthy immune system. This includes things like protein, whole grains, and organic fruit. Also, being active has numerous benefits like increased muscle mass, decreased risk of complications such as heart disease and diabetes, and minimized feelings of depression. Both a healthy diet and active lifestyle with a HIV medication regimen can contribute to controlling the disease. All nutrition and exercise inquiries should be directed to a healthcare provider.